Would you like to learn more about post-traumatic stress disorder so that you can better understand your own recovery from trauma or somebody else's? Well, if so, then this video is for you today. I have some notes that I took on post-traumatic stress disorder, and I'll have citations in the descriptions for you as well. So I just wanted to start with one of the probably the symptoms that you might see most commonly in books or movies or TV shows, which is flashbacks. So these are re-experiencing symptoms. And you can think of these as basically being a piece of memory that is coming up in the present moment. And it could come up on a sensation level, like in the body. It could come up as an emotion or as a physiological or like behavioral piece. For example, like someone automatically making a fist or flinching or like their heart racing. It could come up in a lot of different ways. Basically, in any way that we experience memory, this kind of flashback can occur. It can also dreams, so nightmares or trauma dreams that have a theme related to the trauma, such as feeling out of control or feeling unsafe, running away from a predator or a perpetrator. Those kinds of dreams can also be considered re-experiencing or flashbacks. Dissociative states, where events are relived and somebody behaves as if that event is occurring. So it's like this could be seconds or days in duration, where someone is just kind of lost in that past. And they might be behaving as if that past trauma is occurring in the present day moment. It's important to mention that these re-experiencing symptoms, they happen on a continuum. So on the one end, you have people who are fully aware of the present moment, and then this re-experiencing, this little piece of memory is present with them, and it's kind of pulling them towards the past a little bit. And then on the other end, you have people who have completely lost that present moment reality, and it's as if the past is completely present. So just kind of good to mention that because the way to support someone is going to look very differently depending on where they are on that continuum. Because if you say to someone who's completely in the past, like, why are you acting this way? Or, holding their actions against them, it's not going to make sense. But we can work with them on returning to the present moment safely. Which is why safety is the priority in trauma therapy. We always prioritize safety and stabilization first, because we don't want people to lose awareness of that present moment. We don't want re-experiencing to be dangerous. We just really want to support the recovery. Okay, so the next set of symptoms is avoidance. So this is deliberate attempts to avoid reminders or triggers of the original event. This one sounds like not a big deal. Like, oh, Kristen, like, why would you care if someone is avoiding, for example, supermarkets, if they were hurt in a supermarket? Well, what if it's not just that supermarket that they had an accident in? What if then they're avoiding all supermarkets? And then they're avoiding all stores because avoidance has this tendency to expand in someone's life. And I've seen this, happen in all kinds of different situations with people where the avoidance starts small, for example, with just the store where an accident happened, and then it's crept outward because the trauma wasn't addressed. They didn't have what they needed to kind of support themselves with their recovery. So that's why I think it's worth paying attention to avoidance, because it's really about someone being able to live freely, and like they did before the trauma, as much as they would like to, and to live a life that's in alignment with their values, of course. Okay, so the next set of symptoms are negative alterations in cognitions or mood. So this means negative changes in thoughts, or mood like fear, horror, anger, guilt, or shame, that worsened or began after the trauma happened. So some of the ways this shows up includes an inability to remember. So this would be dissociative amnesia of a part of the event. Also, exaggerated negative expectations regarding important aspects of life applied to oneself or others or the future. So this might be things like, I can't trust anyone. Um, if I love someone, they will hurt me, stuff like that. Or like I'm always going to be a disappointment, or I can't protect myself, stuff like that. And then they might also have like a negative change in their sense of self because of the trauma. They might have problems with blaming themselves for what happened or blaming other people. And then the piece with this fear, horror, anger, guilt, and shame. This is really important because I think sometimes trauma survivors, they've been coping the best they can with the trauma, but they've engaged in behaviors that continue this cycle and they feed the fear, the horror, the anger, the guilt, or the shame. And so in therapy, it can be really helpful to see, are there any things in your life that you're doing that are contributing and like kind of reinforcing this, you feeling this way, and then also reinforcing the negative belief you have. For example, if someone believes that, people will only um, ever like abandon them, but then they go and they date people who say like, "Oh, I'm not looking for a long-term relationship," or someone who has like a history of leaving marriages or something like that. Like it will likely continue that cycle, right? Like that person will likely leave if they have a history of that, and then it would confirm that belief. So in therapy, there's a lot we can do here to kind of help work through these beliefs and also help break some of the patterns if we work together. And, sometimes it's just very slow, steady work. Another aspect of this group of symptoms is a loss of interest or participating in activities that you used to enjoy. So this is a big reason why we're always encouraging people to find like things that they used to enjoy or things that might be fun or increase the positive emotions and encouraging them to do that as a part of trauma therapy. And another part of this symptom group is a difficulty, a persistent inability to experience positive emotions. So these would be like happiness, joy, satisfaction, or ones that come from intimacy, like tenderness, sexuality, related emotions. And so we can work with those too and see, what activities increase this sense of emotion. There's a lot we can do with emotion regulation in therapy. And I think a lot of times in that first stage of trauma therapy, working with emotion is such an important priority because it plays a big role in PTSD. Working with emotion, working with the beliefs and the thoughts and the behaviors. So just yeah. And then also other pieces of the negative change in mood or thoughts can be someone could be quick-tempered, they could be aggressive, they could be taking a lot of risks. Um, it could also be more sensitive to potential threats. So this is someone who's seeing danger everywhere. The threat system is just activated. I think that, part of the recovery process is just learning how to kind of hold the balance and have like a more adaptive response to threats, kind of knowing that being able to relax actually helps you protect yourself better because you're not in such a state of activation all the time that you can really think clearly and stay oriented to the present moment. Working through startle responses, jumpiness, being really reactive. Another aspect of this group of symptoms or for PTSD is difficulties concentrating, including remembering past events and focusing. So problems focusing. It's normal for people to kind of question like, oh, is there something wrong with my brain? But it's just PTSD for many people, although often like them talking to their primary care doctor or a psychiatrist about their concerns can be helpful too, just to roll out something else that could be going on. But executive functioning, so like that kind of organizational skills, that people sometimes do see harder, like they have a harder time with it because of what they've been through, and how the trauma has impacted them. But there's also strategies we can do to help in that area. Sleep problems are pretty common, which is why a lot of trauma therapy will include, there's things called sleep hygiene, which are like lists of kind of tips and strategies that are recommended through research to help improve the quality of sleep. Also, working with things like nightmares and dreams can be helpful. And then addressing too that arousal, like if their heart rate is always high, like if they're sweaty, if they're always on edge, helping someone like kind of relax and experience safety can help with sleep too. And then the last piece of symptoms here that I'm going to cover are the dissociative symptoms. So this includes like detachment from the body, which is depersonalization, or detachment from the world, which is derealization. And I would say that one of the biggest things for trauma therapy in addition to safety, and focusing on safety, is just having like a very good assessment for dissociation, because when people have post-traumatic stress disorder symptoms, they might also have dissociative symptoms that haven't been caught before in therapy if they haven't worked with someone who specializes in trauma or in dissociation. And once you know that dissociation is present, there are so many coping skills that you can use to help manage it. But if you don't know that it's there, what can happen is you can be in therapy and then the past can really overcome the present. And you can basically experience like re traumatization where you feel like garbage. And you don't feel safe anymore because now you're going to respond with like some of the less healthy coping skills because you've been so traumatized, or so like activated, is how I like to think of it. Is it's just like maybe too much of the trauma has come out and then it's hard to put the lid back on. And so that's when people might reach for like alcohol or marijuana, or maybe they'll self-harm or something else that helped them kind of get through in the past, but right now in the present, it's not, what they want to be doing to help themselves. And so a big part of like that beginning phase of therapy is just finding, like learning more about the symptoms that are present, learning how to manage them, coming up with coping skills that work specifically for that person, and then kind of working piece by piece as someone feels like it's manageable. And that's why I really like that kind of that trauma therapy model where we always begin with safety and stabilization, because I mean, PTSD, as you can tell, it involves a lot of different symptoms. And sometimes people are surprised by how many different symptoms are involved. And they don't realize that someone can have a different presentation of PTSD. For example, some people have more of those flashbacks, and their PTSD symptoms are primarily like flashback heavy. Other people have more of this like really depressed mood, just very down, a lot of negative beliefs, a lot of negative thoughts, um, just really kind of heavy, not much pleasure in life, that presentation. And some people have more arousal. So, like, they're, you know, like go, 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 like on edge, alert, in that kind of fight or flight mode. And they might have more externalizing symptoms. That's like the kind of being a little bit more aggressive, quick-tempered, acting out. That might be the way that their PTSD is showing up. And then some people have dissociative symptoms more predominant. So this would be like the zoning out, spacing out, numbing out, things feeling unreal or dreamlike. And then some people just have combinations of these symptom patterns as well. So I hope that this video was helpful for you today. And I just wanted to kind of close by saying we have a lot of really good options for trauma therapy right now. Um, EMDR is one that I practice, and I found it to be helpful. Also, you can use cognitive behavioral therapy and dialectical behavior therapy to make progress in these areas. Cognitive processing therapy, there's like exposure therapy. We have a lot of tools in the toolbox. And I really hope that this video is helpful for you. It's not meant to be a substitute for working with a therapist, but just educational in nature and to help reduce some of the stigma and the confusion around PTSD. I'll include the citations as well so that you can learn more. If this video is helpful, please feel free to like or share it or subscribe. Thank you for your time.